All right, so this week let's talk about a new trial called bempedoic acid and cardiovascular outcomes in statin intolerant patients. Stay tuned to the end where I talk about how this will influence my practice. I'm Mike Freilich, a general internist in Toronto, and I also work in Sault Ste. Marie. So let's start with understanding what the trial did. So from a method standpoint, the population were adults at increased cardiovascular risk. The intervention was oral bempedoic acid, 180 milligrams daily. The comparator was placebo. And the outcome was this 4-point composite of MACE, or major adverse cardiovascular events, including death from cardiovascular events, non-fatal MI, non-fatal stroke, or coronary revascularization. And the timeline was 40 months, so a pretty long study. Let's understand some more components of the study. Was it placebo-controlled? Yes. How is it funded? It was funded by a pharmaceutical company. Outcome clinically relevant? Absolutely. Was it blinded? Yes. Intention to treat? Yes. And a lot of centers. Was this a multi-center large study? Absolutely. So let's talk about the results here. So they screened 22,000 patients. Overall, almost 14,000 were randomized. Loss to follow-up was rare. That's a really good thing. And the baseline characteristics, average age of 66, half women, average BMI of 30, and most had diabetes, coronary disease. And you can see the mean LDL there of 139 milligrams per deciliter. So what did they find for their primary outcome? You can see that the risk of the primary event was about 11.7% in the bempedoic acid group, 13.3% in the placebo group. So corresponding to sort of almost a 13% relative risk reduction in this primary outcome, which is pretty impressive. And, doing some mental math, maybe 1.5% of absolute risk decrease. Important secondary outcomes. You can pause the slide to read more about them here. Main limitations for this study. So, of course, it was compared to placebo rather than an alternate drug. I get it. These patients were intolerant to statins, but there's other drugs that we use in that scenario. You always wonder about the generalizability of these randomized trials. How well will this actually apply in routine care? But overall, the take-home point that treatment with bempedoic acid compared to placebo significantly reduced the risk of major cardiovascular events in statin-intolerant patients. So for me in my practice, this drug isn't on the market yet, but when it is, certainly for that older adult who they cannot tolerate a statin, this will be a very reasonable option for them. Thank you to Natasha Verhoef for producing this video. She's a med student here at the University of Toronto. That's it. Take care.